And last but not least, and then I'm gonna talk about how you can do if stroke happens. So we're gonna talk about what is stroke like. So what is stroke? When we talk about stroke, we actually talk about cerebral vascular disease, and cerebral vascular disease is caused by one of the following these pathophysical process causing the involving the blood vessels of your brain. And one is the intrinsic vessel abnormality. So you have the atherosclerosis. I think like lots of people heard about this term before. That's the stiffness of your blood vessel causing by the accumulation of a lipid underneath the lining of your blood vessel. And you could have the lysis of your blood vessel. That means when your blood vessel, your blood pressure is not controlled well, and the high blood pressure will causing the accumulation of some abnormal protein underneath the lining of your blood vessel, and your blood vessel will look like a glass in the when the blood pressure is too high. So it's become very thick and then very stiff, so it looks like glass as it block easily, and it can also break easily. And sometimes your blood vessel will suffer from inflammatory process. For example, if you have lupus, it's an autoimmune disease, or you have another abnormal protein deposition, we call it amyloid. We know amyloid is more related to a dementia called Alzheimer's disease, but that's when amyloid accumulates around your neuron cells. But when amyloid deposit accumulates underneath your blood vessel, it will also cause the weakness of the blood vessel and causing stroke. And sometimes the abnormality, including the arterial dissection, you have the congenital malformation of your blood vessels, you have the aneurysmal dilatation, will also cause stroke. And sometimes you have a venous thrombosis. So when we talk about the blood vessel in your brain, we have artery and vein. So imagine your brain is like a sink. So you have the tap to bring in the fresh water, and you have the drain to drain out the dirty water. So in your brain, we have the tap, which is artery, so bring the blood full of oxygen and nutrition, and you have the vein is like serve as like a drain to drain out the used blood. So either artery or vein have problem with causing the cerebral vascular disease. And second pathophysiological process of the stroke is the embolism. That means sometimes your blood vessel is okay, it's perfect, but you have the clot from other part of your body, travel from other part of your body all the way to your brain to clot the blood vessel in your brain, so causing the stroke. And sometimes you have inadequate blood flow, means your brain doesn't have enough perfusion. Sorry, have I closed? Right. So you don't have enough perfusion that would be caused by the decreased perfusion pressure. For example, if you have very low blood pressure or you have massive bleeding, or sometimes you have increased blood viscosity. For example, if you don't drink enough water, or if you have some disease that will increase the blood viscosity. Most commonly we see is the malignancy. If you have cancer, you will have increase the blood viscosity, means your blood is more stickier. And sometimes the vessel rupture will cause the cerebral vascular disease. So that's like quite rather easy to understand. So you have your blood bleeding into your brain, and we call it intracerebral hemorrhage, or you have the blood on the surface of your brain, we call it subarachnoid hemorrhage. So we divide our stroke into two major types. One is the ischemic stroke, and the other is the hemorrhage stroke. For ischemic stroke, it's made basically the blockage of your blood vessel in your brain. So it can be caused by the thrombosis, it could be caused by embolism, or the systemic hypoperfusion. And it consists of 85% of all the stroke. And the rest of 15% of stroke is the hemorrhage stroke, and it's quite straightforward. It's because of the rupture of your blood vessel and causing the blood comes out from your blood vessel to your brain, and that is the intracerebral hemorrhage, or on the surface of your brain is called subarachnoid hemorrhage. And stroke has been long been the second most common cause of mortality and disability. And the incident rate of stroke in your whole life is the 1 in 6 patient, meaning 1 in 6 people will suffer from at least one stroke in your whole life. So that's very common. And in Taiwan, with because we have the excellent healthcare and advanced public health services, so stroke has been dropped to the fourth common cause of mortality. But with the more survivor of stroke, we just talked about that we have more disability. Actually, that would cause another issue. So the impact of stroke to a society is mostly caused by the post-stroke disability. And a third of the stroke survivor will have very minor symptoms. They pretty much have nothing different. So they can live independently, they can work and live as normal. But a third of the stroke survivor will suffer from moderate post-stroke disability. That means they are partially dependent. So they might have to walk with crutch or even with wheelchair. They can walk slowly, but they cannot go up or down the staircase. They might be able to drag a little bit, but they cannot swing or they just need a little bit of help in their daily life. But another third of the stroke survivor, they will suffer from severe disability. That means they are completely dependent. So they might be bedridden, they cannot feed themselves, they might be fed by the tube, they have to bath by other people, they might not be even speak, they might even have the cognitive problem, they cannot recognize their family. So stroke actually have a great impact to our society, and it's also a very great economic burden to the sufferer and also to the whole country. So we just talked about we divide stroke type into two major types. One is ischemia, the other is the hemorrhage, and it's because ischemic stroke composed of the majority of the stroke. So we have a deeper look at the ischemic stroke. We actually divide the ischemic stroke into five subtypes. And the first one is a large artery atherosclerosis. That means we talk about atherosclerosis all the time today, and that means the stiffness and the clot of your blood vessels. It will cause the hypoperfusion, means not enough blood flow to your brain, and the rupture of the plaque on your blood vessel will causing the artery to artery emboli. And the second subtype of your ischemic stroke is the small vessel disease. By small, I mean the blood vessel you cannot see really on any type of the examination. This is the microscopic grade of small. So these small vessels, when they are blocked, they're causing the lacume on your brain imaging. That is what we call lacunar stroke. And this type of stroke, sometimes they have symptoms, sometimes they don't. But with accumulation of several or repeating lacunar stroke, you might suffer from, for example, cognitive dysfunction, like we call the vascular dementia, or you have the problem with your gait, we call it vascular Parkinsonism. And the third subtype of ischemic stroke is cardiac embolism, and that means you have nothing wrong. You might not have anything wrong with your blood vessel in your brain, but it's because your heart produced some kind of emboli, and they travel from your heart all the way to your brain to block the blood vessels in your brain, causing the stroke. And the mechanism for the cardiac embolism, including atrial fibrillation. So our heart is like a two-level apartment, and the top floor we call it atrium, and the lower floor we call it ventricle. So these rooms between them, sometimes they have the door, and sometimes the room can shake by themselves and will produce the emboli, so we call it like atrial fibrillation. And we have valvular heart disease. That means that sometimes the door between each rooms have some problem, so they will also produce the emboli from your heart to your brain. And sometimes the ventricle has thrombus itself, so the thrombus will just travel all the way to your brain. And lots of other heart disease will also cause the ischemic stroke. And a large part of the ischemic stroke, even though we try our best, we still can't determine the etiology of the cause, that we call it undetermined. And very small part of them is all determined. Most of them are very rare diseases. For example, like thrombotic state. When will you have thrombotic state? Like when you have cancer or when you are pregnant, you have thrombotic state, or sometimes you have some genetic disease. And sometimes you have problem with your blood vessels, but are causing the dissection of your blood vessels. You have the inflammation of your blood vessels, or you have a certain rare type of migraine causing the severe vasospasm. That means the spasm narrowing of your vessel and causing inadequate blood flow to your brain. Or if you consume some illegal drugs like heroin or amphetamine, that will cause the inflammation of your blood vessel. That will also cause ischemic stroke. So we talk about the atherosclerosis. So let's look at the atherosclerosis. On your screen, you can see a very big blood vessel. On your left hand side, that's the normal artery. That's what it looks like when you were born. Okay, so our blood vessel, like since you were born, has the accumulation of a fatty streak underneath lining of your blood vessel since you were born. But when you were younger, your diet is more like light, and your ability to remove the fatty streak is better, so usually you won't see the accumulation of your fatty streak. But then when you grow old, you eat more and more oil, greasy food, and the ability to remove these fatty streak is lower. So you have the buildup of the lipid underneath the lining of your blood vessel gradually, and that's when we call it atheroma. But then, because these atheroma will also cause the inflammation underneath the lining of your blood vessel, so they will accumulate more and more collagen, smooth muscle, everything, a lot of everything, and causing the thicker and thicker of the atheroma, we will call it plaque. And the plaque, the problem of the plaque, will cause the critical stenosis of your blood vessel that will causing the blockage of the blood to your brain. And sometimes the black plaque is too large, they will break. So the the clot will travel further distal to block your blood vessel, as we call it thrombus. So that's how atherosclerosis causing the ischemic stroke. And the risk factor of atherosclerosis we just talked about, because aging is one of the biggest risk factor for atherosclerosis. And also if you have a family history of early heart disease, by early I mean under 55-year-old, and also if you eat unhealthily, you have diabetes, you didn't control your blood pressure or your cholesterol, or you have high level of C-reactive protein, it's a marker for blood vessel inflammation. Or if you didn't exercise enough, you cannot control your weight, if you have sleep apnea, you smoke or other tobacco, that all these are the risk factor for the development of atherosclerosis. And it's so we talk about atherosclerosis because that's the major risk factor for the ischemic stroke. And how about hemorrhage stroke? We say hemorrhage stroke is simply the rupture of your blood vessel. But what happened to your blood vessel to cause the rupture? Still, atherosclerosis is still the major risk factor, the reason to cause the rupture of your blood vessel. And the second common cause for the hemorrhagic stroke is the hyalinization of your blood vessel. What is hyalinization? Hyalinization means your blood vessel become like a glass. So it's very hard, it's very stiff, and it's prone to rupture. And why does it happen? Is because you have uncontrolled hypertension. If your blood pressure is too high, and usually your blood vessel will have the abnormal accumulation of plasma protein. And mainly we call it complement, but it's not important anyway. It's an inflammatory process related protein. So it means your blood pressure is under when this blood pressure is too high, your blood vessels under the inflammatory process, and with accumulation of these abnormal protein causing the stiffness and fragility of your blood vessel, and it's prone to rupture. And sometimes you have the amyloidosis of your blood vessel. Amyloid, we know, is another abnormal protein. If it's accumulate around your neuron, it will cause Alzheimer's disease. However, if amyloid accumulates around your blood vessel, let's look at this figure. If you look at the lower part, the red part, or the abnormal accumulation of amyloid protein, they will disrupt the lining of your blood vessel and causing the affecting the integrity of your blood vessel. And so the blood vessel will prone to clot or prone to rupture, and that will also cause the hemorrhagic stroke. So but when we talk about the cerebral vascular disease, we know it's the blockage of blood flow. And how will blockage of blood flow damage your brain? And it is because the brain is composed of neuron cell, and neuron cells are very, very sensitive to the level of the oxygen in your blood. So imagine, so if this blood vessel is clogged, and the area immediately related to this blood vessel um, will be will be damaged completely within like 10 minutes. So within 10 minutes of ischemia, the neuron will suffer from permanent damage. And this area we will call the infarct core. And the area around the infarct core, usually they will have some blood vessel from other direction, kind of like to help them. So they kind of like have reduced blood flow, but they if they we didn't recanalize the blood vessel in time, this area we call it penumbra will still become the infarct area if the recanalization therapy was not done in time. So that's why it is very important to recognize the early symptoms of stroke and send the patient to the hospital as early as possible. But before we move on to the symptoms of stroke, I want to talk about how you can do to prevent the occurrence of stroke, because I think prevention is more important than the treatment, because any kind of stroke will leave a variable grade of disability. So I think prevention is more important. So let's talk about the prevention first. So the risk factor for stroke, we divide the risk factor into non-modifiable and modifiable. For non-modifiable, that means you can't do anything about it. For example, age. So for males older than 45-year-old and the female older than 55-year-old, or any male actually is the risk factor of the stroke. And also if you have the family history of early myocardial infarction. So for example, your parents, your siblings have myocardial infarctions earlier than before the 55-year-old, and then you are at risk of a stroke. But there are more you can do because there are more modifiable risk factor of stroke. For example, if you have diabetes, if you have tension, if you have high cholesterol, you have heart diseases, or if you have unhealthy lifestyle, for example, like obesity, smoking, or inactivity, means an inadequate exercise. These are the things you can do, lots of things about it to control your risk factor. So let's first talk about the blood sugar control, because I think diabetes is the most severe um, public health issue, I think, is around the world, because we have more and more diabetes patients nowadays because of our diet and the people eat more. And diabetes is an independent risk of stroke. And adults with diabetes are 1.5 to 3 times more likely to have a stroke than the patient who don't have it. So apart from the medication treatment, because I think that's the responsibility for a doctor, but for a patient, if you have diabetes, there's lots of things you can do. So first thing is the weight control. Okay, so in Taiwan, our normal body mass index BMI is that between 24 and 27 kilometer per square meter. But I think the different country might have slightly different regulation, but it's pretty much a similar range as Taiwan. So if you have overweight or obesity, you are twice more likely to develop stroke. So control body weight is very important, and control your body weight can also control your blood sugar. So if you can reduce 5 to 10% of your body weight, you can also reduce zero point 0.6 to 1% of the glycated hemoglobin. Glycated hemoglobin is kind of like a marker to monitor our blood sugar, and normally it's 0.5%. And for a patient with diabetes, I hope you can control it under 7 and ideally under 6.5%. That's we call a very good control of blood sugar. And what you can do to control your blood sugar, the secondly, is the diet control. So more whole food, so like whole grain, brown rice, or oats, but less refined starch. Refined starch means anything made by flour, so noodles or like a toast bread or cake, biscuits, these things. That's so try not to eat refined starch, but more whole food. And physical activity is also very important for good blood sugar control. So what is physical activity? How much activity you should need? So WHO, the World Health Organization, has defined that you should have at least 115 minutes of exercise a week. That's moderate intensity aerobic activity. So it's like you swim, either you swim, you cycling, you jog slowly, or you walk fastly. So it's around like 30 minutes a day if you exercise 5 days, plus at least 2 days in a week for muscle strengthening activity. So it's more like weight training or the core muscle training. So that's what we say activity. So this is like any figure you can download from the WHO web page. So it says 150 to 300 minutes per week for normal adults, and if plus 2 days a week of the strengthening activity. So that's the weight training, core muscle training, or if you're an older adult, you do 3 days a week, but like minor exercise, basically to keep your balance and your muscle strength. So the more the better. So activity, the more the better. And for the blood pressure control, so recent study and guideline, we have changed the blood pressure target to 130 over 80 millimeter mercury for both primary and recurrent stroke prevention. So that this standard of blood pressure applies to all age groups. I say this because I don't know why in my country, lots of patients, like they are very old, like 70, 80s, they always tells me, oh, my blood pressure is 140, 150. That's good because I'm old. So I have to stress again, 130 over 80. This standard applies to all age group. And actually, if your blood pressure is about 130 for systolic or 80 for diastolic, it's already stage one hypertension. It's better to have your blood pressure, especially systolic, around like 120. Okay, so it's because nowadays the blood pressure regulation is more and more strict, because we found out in lots of large scale clinical trial, lower blood pressure actually have better outcome in terms of the stroke prevention, AMI prevention. So what you can do about the blood pressure control apart from your medication, you lose weight. So weight, to control your weight is very important. You exercise and you eat a healthy diet, and you reduce your salt consumption, and don't drink too much alcohol, and stop smoking, and sleep well, reduce stress. And most important of all is to monitor your blood pressure at home, because I think 90% of patients, when they measure their blood pressure in the hospital, is usually very high because they're very nervous. They have white coat hypertension. But if you notice the blood pressure at home is still very high, you should get regular checkup and also get support from the medical personnel. And the third risk factor control is the blood lipid control. And hyperlipidemia, or the high blood lipids, strongly related to your heart disease, coronary heart disease. Not so strong to all types of stroke, but even so, we still think you should control your total cholesterol level underneath 200 milligram per deciliter. And LDL is the bad cholesterol. It's low density lipoprotein. We call it bad cholesterol. We hope everyone can control your LDL under 130 milligram per deciliter. And what you can do about to control your lipid is eat less fat. So you eat lean meat as much as possible. You cut away the fat or skin. You don't deep fry your food, and you try to choose the low fat dairy products and add more fiber in your diet. And also exercise and weight control is still very, very important. So apart from these risk factor control, the medication control, I don't think that's the I should talk about it here, because I think that's the responsibility of doctor. So I wouldn't put too much emphasis here today. So let's move on how you can recognize stroke early and what you do if stroke happens. So let's remember FAST, FAST. So it's called fast because that's the beginning of forward face dropping. So you have, if you notice the face asymmetry, you cannot move one side of your face very well, or you have weakness of your arms, you cannot speak very clearly, or you cannot express yourself very clearly. And it's just better to call your ambulance as early as possible. The T means time. So in United States, it's 911. In Taiwan, it's 119. I'm not sure what's the number in Malaysia, but it's better to write it down in your in your wall because time is brain. Why do I say time is brain? Because the longer you your tissue, your brain tissue suffer from ischemia, the larger area there would be, and the less likely they will be salvageable. And but time is more with brain when you time the brain. How do we time the brain? And this is why I want to introduce here, because as a tertiary stroke center, this is what we can do if we have the stroke patient who are recognized at very early time and sent to our hospital, what our hospital can do. So first of all, if you are very lucky to be sent to the hospital at very early hour of your stroke happened, we would do some very advanced stroke imaging, the brain imaging, we call it CT angiography with perfusion scan. And we will use the artificial intelligence software to calculate your brain area. So the purple area in this brain scan imaging is the ischemic core, meaning these area are like dead completely. You can't save them at all. But then we also calculate the area, we call it penumbra. Remember, that's the area around the ischemic core. That's the area still salvageable. So we can decide the amount of the salvageable brain tissue and decide whether this kind of patient, this patient who suffer from stroke and but recognized at a very early time, who can whether be able to receive the recognition therapy. By recognition therapy, I mean either intravenous thrombolysis or endovascular thrombectomy. Intravenous thrombolysis means we inject some kind of medicine into your blood vessel, and that medicine can try basically from your arm, because the IV usually the needles is usually put it in your arm, but the medicine will travel all the way to your brain and to lyse the blood clots that block your blood vessels in your brain. Okay, but so that's we call IVT, intravenous thrombolysis. And we could also do the endovascular thrombectomy, EVT, which means we put a metal device from your growing area and the guide wire and the device with the device travel all the way to the blood vessel in your brain and to remove the clot in your blood vessel. But to receive this kind of recognition therapy, first of all, you have to be that had to be applied. For example, IVT has to be applied within 4.5 hours of stroke. Means you have to arrive the hospital about 3.5 hours after stroke, because you need to leave 1 hour for the doctors to do all the examination and to decide whether you can receive this treatment or not. So that's why it is very important to recognize your symptom as quickly as possible. But of course, this kind of treatment, and for example, IVT, intravenous thrombolysis, will increase 33% of good outcome in ischemic stroke patient. But it also has its complication. It's because when you recognize the blood vessel, they will cause bleeding, but it's not as high as the because the it's not as high as the benefit you will receive. So nowadays, the guidelines still consider IVT is the standard and the best treatment for acute stroke treatment. And for endovascular, I just put a figure here for you to understand. We have a basic concept like about what it look like. So, for example, the blood vessel here in your brain, you can see, and this is very thin here because that it got a very big blood clot here to start to block the blood vessel, the blood flow. And what we do is to put a device inside your blood vessels and go all the way to the blockage area in your brain to take out the clot. So this is what it looks like of the clot when it was taken out. So after we took out the clot, you can see the recognition of the blood vessel, all the blood vessel you can see after this work. So if we have the blockage of this blood vessel at this area, if we didn't do anything about it, originally the whole area of this half the brain will probably go dead. We won't save it. But with this procedure, only the white area is is dead completely, but all the rest area has been saved with this endovascular thrombectomy procedure. So this is the very successful treatment protocol, but it only applies to the patient who can be sent to the hospital as early as possible. And for the medication to prevent stroke is also, I don't think it's the topic I should talk about here today. And for the weakness and the disability caused by the stroke, what you can do is rehabilitation, and as early as possible. And I believe the next speaker is the expert, so I think she was going to talk about more um, of this topic later. And because before this talk yesterday, I received a little bit of the um, question asking about the acupuncture. I'm actually not an expert in the acupuncture for stroke, but I mean, acupuncture is only recommended by the WHO as alternative and complementary strategy for stroke treatment. It could improve the balance and also reduce the muscle spasm of your limbs and also increase the strength. But the mechanism for acupuncture for stroke treatment is actually unclear, and we recommend it to apply it alongside with the standard treatment. And typically, we start it within 3 to 10 days after the stroke onset. So I'm going to end my talk with my last slide. So we know we have two types of stroke. 85% is ischemia, 15 is hemorrhage stroke, but they have very similar risk factor. Apart from the non-modifiable risk factor, you can control your modifiable risk factor, your blood sugar, pressure, lipids, your heart diseases, your weight, start smoking, and exercise more. And to spot the stroke, you use the FAST. Your face asymmetry, arm weakness, speech difficulty, and call your ambulance in time. So thank you very much for your attention, and I am more than happy to take your question.
Thank you very much, Dr. Wu, for your very detailed and comprehensive talk on acute stroke, what it is and how to prevent it, and also how to manage the acute stages of it. Also, thank you for taking the trouble to go through the questions that were sent in by our participants, and I think you've covered every single question that was initially sent to us. It's interesting that in Malaysia at least, and also I believe in this part of the world, that the types of strokes that we have is doesn't follow the traditional Western 85% ischemic, 15% hemorrhagic distribution. It's actually very much more 50% type of distribution. We have many more hemorrhagic strokes ratio. Do you have that same experience in Taiwan as well?
And yeah, I think in Taiwan we have about like 80-20. Like 80%. So slightly more hemorrhage. I think it applies to all Asian countries. I think it's also because the genetic background. And
Right.
also for the vessel disease, for example, for Western or the Caucasian, they have more large vessel disease, means you have the blockage of the vessel of your neck. But for the Asian, we have the blockage of vessel inside your brain. So it's also like quite different. I think it's also the genetic background.
Yeah. And is there, in terms of prevention, you mentioned very well the different roles of hyalinization and amyloid deposition. Previously, everybody was just talking about atherosclerosis, but is there any preventive measures in particular for these two processes, hyalinization and amyloid deposition? Because I think a lot of us are. What we do see is that people who do live healthily and but still end up with a stroke, and that's, I think, one of the main concerns that most people still have.
And yes, for hyalinization is because it's majorly related to your blood pressure. So control your blood pressure is the best way to prevent the hyalinization of your blood vessel. But for amyloidosis, so far there's no good way to prevent it. It's because the mechanism for the amyloidosis is not quite clear yet. But we do have some examination to look at it. For example, if we do the MRI scan, there's condition we call SWI, or we call it SWAN. It's for typically for the hemosiderin, means the heme inside your blood. When they accumulate in your brain, we can use the MRI, that particular condition, to see it. So for example, if we have the especially we have the hemorrhagic stroke, in our hospital, we routinely do the MRI scan with that SWI condition. It's because we can find out, other than that hematoma, sometimes the patient already have a lot of hemosiderin accumulated inside your brain. And by the location of those hemosiderin, or we call cerebral microbleeds, we can kind of separate them into whether they are hypertensive accumulation of amyloid, or the real amyloid accumulation. That's we call cerebral amyloid angiopathy. But other than that, that's only the phenomenon we see. But for amyloid angiopathy, we at this moment we don't have any way to prevent it. We can
Mm,
only see it, and but control your blood pressure, and is still the best way
mm,
to reduce and to protect your blood pressure, your blood vessels.
mm. I think one of the questions that the participants had was relating to a second opinion. I believe this was the situation is situations like this where if a person has had a minor stroke, which or a stroke, which means they have more or less recovered most of their function or had very little residual deficit. But now they're worried when will I get a second one which is worse, and so on, or and they want to have an opinion, or they want to have a more investigation to try to find out which are the areas that they can do, and they can change, or they can improve on. Is there any do you recommend them to seek a second opinion, maybe with you and your team in Chang Gung Memorial?
I would definitely recommend that. But um, the care of stroke, the prevention, and also the care is divided into the acute care and the secondary. Acute care is basically is best to do done at local, because time is brain. But for the secondary prevention, um, for example, some people have minor stroke, but they have lots of like very severe stenosis of your blood vessel. So that might involve into the secondary prevention. So the for secondary prevention part, I do recommend like further examination to make sure we do the right thing. For example, sometimes if we control the blood pressure, blood sugar, they still can't um, stop the stenosis of blood vessel from getting worse and worse. So there might be some other intervention to do. For example, the stenting of your intracranial blood vessels, or the um, angioplasty. So that needs a lot of procedure evaluation. So in that case, I would do recommend second opinion. Yes.
So some of these can be done in local hospitals, but also some further investigations also may be done at Chang Gung or so on.
Yes.
Right. So for those who may be interested, just a plug-in, you may actually contact Tiffany at the TAMC, and who may give you some information on how to proceed on to obtaining a second opinion or consultation with Chang Gung Memorial. With regard to the early and acute management in Malaysia, and at least in Penang, I think it's important to note that getting early access to the hospital is very important, and therefore it's important also to know which hospitals have an acute stroke protocol, which means that which hospitals have an ability to initiate at least uh, thrombolytic therapies with regards to medication. Not so maybe endovascular, maybe not yet, only in Pantai, but otherwise thrombolytic medications are available in some private hospitals, in Penang General Hospital, as well in Hospital Seberang Jaya. Just to let those speakers who are those participants who are mainly in Penang. No, it's not all hospitals have a stroke protocol, so picking the right hospital is probably more important. Okay, so any questions from the team? Maybe you can put in your chat group at the moment, and I'm quite sure Dr. Wu will be very happy to answer that. Are you on mute?
Yeah, I think Sabita.
Lo Siu Kim, can you mute? I'll just mute. Okay, all right. Okay, so we have one question from our audience here. It's in the meeting chat. What is your advice? 30-year-old female, strong flight history.
Strong family history, yeah.
Strong family history, had history of few episodes of hypertension.
Oh, okay, I see it now. Let me go through it, right? Yeah, okay. So, Dr. Wu, I'm not sure whether you can see it, but it's
yes, I can actually read it.
Yeah,
So it's actually the control about blood pressure, like episodic elevated blood pressure, but like okay. For example, the baseline blood pressure saying here 120 to 140 over 80 to 95 for me is already high blood pressure. But 30-year-old is very young, so I still recommend non pharmacological first. But usually we observe this kind of blood pressure for about like 6 months. So if after 6 months you do have exercise and you eat healthily, but unfortunately, I think that it says here she doesn't have exercise and she eats unhealthily. But I would still recommend exercise and diet modification first. But if after 6 months these kind of blood pressure like 120 140 over 80 to 95 remains, I would recommend treatment like the medication intervention, because you can't just leave it as high as that much. But in the meantime, we also need to find out other reason to causing the high blood pressure, for example, thyroid problem, any endocrine problem, and also the stress, because the stress part you can be managed by psychological problem, like they might need a little bit help from the psychiatrist or psychologist. So I think with all this that they can like control the blood pressure, but not just to give her the antihypertensive drug immediately.
Yeah, I would like to echo what Dr. Wu has just said. I think for a 30-year-old with with those readings is something to be concerned about, and definitely need to have follow-up and further investigations. It's definitely something not to ignore and not to just attribute to single episodes of stress or can be managed with counseling. It's not something. It's something to worry about and to do something about. Yeah, and they have very good mechanisms in the clinics, in the health clinics, public health clinics that deal with this. Or otherwise, they can seek further therapies in general practice or in private hospitals, but not to ignore. Yeah, there's another question there from Lily.
Okay, I can see that. So the blood pressure too low. How can we do? Lower blood pressure
That's
is
not too low, huh?
usually.
That's very good, huh?
I think it's very good as well. I think that's a very good blood pressure. So it's not too low. When you don't have any symptom, you don't worry about it, and just maintain your exercise. And most important of all, enough fluid intake, because I think that water intake is sometimes being neglected by lots of people. So once 110 over 60 is not too low. I think it's very good, but just remember to exercise and to drink more water.
I think just to add in, if you don't mind me adding in, I think you consider blood pressures too low is when they give you symptoms, meaning that if you get up from sitting down, from your lying down, you get up and you feel giddy, or you find that you are not you start getting giddy or having weaknesses when you start doing work, then you might worry about your blood pressure being too low. But otherwise, if you don't have any kind of symptoms like that, then they are not too low. Okay, so or your blood pressure is good for you, unless you have symptoms. Right. So if that's the final question, please, I think our participants and myself and Tiffany would like to thank Dr. Wu very much for taking your time this Saturday and for this very, very comprehensive and detailed talk about stroke, which was very informative for all of us, myself included. And thank you very much for taking the time. Thank you, Dr.
Thank
Wu.
you very much as well. Thank you for your
Stay
Thank
on,
attention.
you, Dr.
everybody,
Wu.
because our next talk is also very important because you remember Dr. Wu did say that 1/3 of people who had a stroke have very few symptoms and recover. 1/3 have a few remaining residual deficits, and 1/3 remain severely have severe deficits. And one of the reasons why some people recover is because they go through a rehabilitation process, and very often this rehabilitation is pretty aggressive and done pretty early, and therefore we are very keen to discuss today how do we proceed on to early rehabilitation, and what are the ways to do it, and what are tools that can help us do it well. And to help us answer this question today, we have Roberta Ong, who's a very senior physiotherapist with Keeogo. And Keeogo is a robotic solution for rehabilitation for stroke. So please join me in welcoming Roberta. Roberta, welcome. You have the stage.
Okay, thank you, Doctor, for introduction. So, and also thank you, TAMC, for inviting us to give a talk here. So, without further ado, I will share my slide. Okay. So, is everyone can see my slide?
Yes, Roberta, we can see your slide. Thank you.
Okay, so just brief introduction about our center. We are from Keeogo Robotic Training Center. So we are giving a rehabilitation therapy for those patients having injury or like impairments, and we are using various robotic device for in our treatment as well. So today I will just introduction about Keeogo in the stroke rehabilitation. Okay, so when we come to stroke rehabilitation, we have 3 phases. First is acute, which is between 2 weeks from the first stroke attack, and post-stroke is after 3 months. Okay, so usually people will neglect about rehabilitation after stroke, which can cause them having like a lot of impairments during their daily activities and also their tasks. Okay, so during acute stroke, we can start rehabilitation as soon as they just admit to the hospital and as soon as they are found to have this stroke problem. But definitely we have to make sure that patient is alert and they are aware of what they are doing on. And also we we cannot do too aggressive exercise during the acute stroke, because we still want them to get used to their body recovery. So if let's say the exercise is too intensive, sometimes it may cause like blood pressure increase. So what we want to avoid from as well. Okay, but we have to do we can do a lot of exercise during a day. Just we have to break it more during acute phase. Then, okay, so as just now, Dr. Wood did present that for stroke, after stroke, right, that is like from mild to severe impairment. So during the first acute phase, same as well for the rehabilitation, we receive patients whether they are minimum impairments or they are moderate or they are in severe impairment. So if let's say they are in severe impairment, which is they can't walk and can't move, we can, as a physiotherapist, we can only do like exercise earlier mobilization to prevent and also to minimize the secondary complication like bed sore, pressure sore, others heart disease or DVT, which we want to avoid. So that's why we can do like passive movement, bed turning, bed mobility to turn the patient around to avoid all that. But if let's say the patient is medically is stable, we can do exercise like walking, gait training, balance training, and also activities task training as well. Okay, so we will go to Keeogo. So I will introduce about Keeogo. Keeogo is actually a dermoskeleton, which is a orthosis that fit to the lower limb that we can wear on the patient, which help them to train their gait, train their movement pattern, their gait, walking. And you can see from the picture here, so you can see the Keeogo actually is totally attached to the patient thigh and calf. Okay, so now we see how Keeogo works. Keeogo first is a patient initiative movement, which means the patient have to have at least some certain degree of leg movement. Then we can use this one to train on to improve their strength, to improve their gait pattern. And we have two sensors in the Keeogo. So these two sensors is attached at the hip and knee to sense the patient movement and give assistive support for the patient while they are moving around. And this is AI software, so it interprets the patient movement. Then it will transfer the movement to the knee motor here, and this is how the supporting comes from the knee movement. Okay, so Keeogo is also orthotic structure. It's maintain the patient's stability and strength. So you can see this thing is like device is fixed. So if let's say they don't have stable knee, when they walk, they may buckle or they may like shrink around the leg, which this orthotic device can help them to stabilize when they are moving around. So now let's see how Keeogo can help in weight bearing. So usually we can see patients with stroke, they are finding difficulty from sit to stand or from stand to sit because they are already neglecting the affected side. So with the Keeogo assistant, it can help them to support them from standing to sit, which can avoid them from fall, and also from sitting to stand, it will give a push and help them to like initiate movement that know how to stand up from sit. Okay, so basically Keeogo is can correct the patient gait stability, improve their knee stability, and also to improve their walking capacity. Then basically also can help them to improve their confidence when walk, which most of the patients they want to. So most of you may think about how and when is the time that we can use Keeogo for training. So Keeogo can start as soon as in acute phase, but definitely we have to make sure that patient is stable. If let's say they can sit stably without support, they can start to use Keeogo for like strength training. But for gait training, we have to make sure at least patient can stand, even though with support with assistive device, and can walk at least 1 to 2 steps with assistive device, then we can use Keeogo for their gait training. So it doesn't mean that we have to wait until they are in chronic phase, because some of the chronic phase patients, they may still bedbound, which we are still not suitable for using Keeogo. But some of the acute phase patient, which is like a minimal stroke patient, they can walk around, they can sit stably. We can start to use Keeogo to train their balance. Okay. So from here, I give some summary of the Keeogo physiotherapy management for stroke. So if let's say patient admit to the hospital, if they are in bed bound, so we have to do a lot passive movement, bed mobility to avoid secondary complication. Okay, then slowly we'll go to bed exercise, strengthening exercise if once they are more stable. Then balance and sitting control, trunk control, and transition from sit to standing, and to gait training up to the advanced training, like go back to their work or their sport. So from this sitting and balance control itself, we can start to use Keeogo. So this is basically how Keeogo can improve. Keeogo mainly can improve the strength, coordination, balance, stability, can use for functioning gait training, and can use Keeogo for sport training as well. So if let's say those stroke patients, they want to go back to their golf maybe, so we can use this one to train on their own field sport training. Okay, so now let's see some of the patients with stroke, how we can train. So from the video here, you can see. Okay. So basically, this patient having left side hemi. So he find that he having difficulty in from sitting to standing, and from standing to sitting, he don't have any confidence. So he find that it is quite heavy for him to do that task, and he need support. So we are using Keeogo. So you can see from the second video here, he are trying to let go his hand while he going to sit and stand, which it will only use his own lower limb strength. Then you can see from the video, second video here. So when he stand up, it's quite easy for him, as the Keeogo is assisting him to stand up. So somehow it will improve his neuroplasticity, and he will learn the movement pattern. It will go into his place. This is from front view. So from this video, you can see patient is using his right hand to push himself up to stand. And you can see the weight bearing, he is bearing more weight on his right side. So he somehow like lacking of strength on the affected side. So from this one, we can adjust the parameter from the Keeogo, and we give intense of strength on the affected side so that he will have to force himself to use the strength on the affected side. Okay. So this is another patient. So he having the problem, his complaint is more on the walking. So when the first video, you can see that when he walk, right, he's leaning more on the left side. So kind of like the balancing is not that good. When with Keeogo, you can see from the back here, the trunk is more stable as compared to without Keeogo. So this is how we train him to improve his trunk stability and also the gait stability. We also using Keeogo for stair training. So the first session of the Keeogo training, stair training, so patients still find difficulty to climb up the stair. And also you can see the trunk shape is a lot leaning on the left side. But after few sessions of training, he can basically cross over the step. Even the stability is much more better as compared to the first trial. I think the video is not working well, but okay, just let you all see. So basically, for stroke patient, right, they usually going downstairs with the affected side first. But as you can see from this patient, he can going down with the non-affected side because he has gained his supporting on the affected side. So he got a stronger right leg stability. So that's why he can come down with the left leg first. So we are also using Keeogo to train them crossing the obstacle to improve their gait and the stability. So this is one kind like one level up challenge exercise for them. And reaching down. So basically we are asking the patient to reach down to the cone and put the ring on the cone. Okay. Ball exercise to improve his leg stability. Okay. So this one is to improve his single leg support and the trunk stability while he doing kicking the ball. Then we will also do others kind of like tasks to challenge their weight weight bearing on the affected leg, knee control, and also the trunk stability. So this is the first video is walk with zigzag and side walk. Okay. We also will do some outdoor activity so that patients are more confident to go back to the society. So this one, we are challenging him to crossing the gap without stop. So you can see how the patient improve. He can walk over the gap without stopping. So some of the patient, if they're having stability problem, they need to pause for a while. Yeah. Then we challenge him to walk on the escalator. But just to let you all know, this escalator is not moving. We are just challenge him to go up and down here. Yeah. So I will end my session with that. There is a hope after stroke. So the rehabilitation is very important. Thank you.
Thank you, Roberta. I'm quite sure some of you have some questions as well. But before we go to your questions, I think just take the opportunity to stress a few points. I think the first point is that the opportunity for rehabilitation after stroke, although it's not immediately after stroke, but it is actually in the early weeks and months after stroke. That's the early one. That's when the best opportunity for rehabilitation occurs then. If we wait years, 1 year or 2 years after that, then the opportunity actually becomes less and less. Because it's much harder to gain back what we have lost if we start late. So it's actually more important to start early after stroke. The most recovery can be obtained in the first 6 months after a stroke. So therefore, any rehabilitation should start early. That's why I think that's what Dr. Wu said as well. Rehabilitation should start early. The second point that maybe I take the opportunity to talk about also is that I also had asked a question when I first see robotic physiotherapy. I was asking the question, I thought after stroke we have to encourage exercise. Why use a robotic assistance to do the work? Then only I understand the concept behind it. The concept is that, you know, in a patient after the stroke, when they have difficulty in moving certain parts, is that they get a few things happen. Number one, they get tired very easily, and number two, because they get tired very easily, they give up. So there's a lot of loss of motivation, and therefore the amount of times that they actually do the work that is needed is much less. So they can actually do, let's say they have to do a certain repetition. They have to move that part, let's say 10 times or 20 times. Maybe they can only move 5 times and then they get tired, right? So, and therefore the recovery is slow and is maybe limited. On the other hand, when we use a robotic physiotherapy like Keeogo, what happens is that the robot assists a little bit in that movement, so that it becomes not so difficult at first. It becomes not so difficult. So they can move a little bit, and then the robot can help a little bit. So now instead of moving just 5 times, they can move 10 times, or they move 20 times. And that movement itself teaches the brain, this is the movement that I need to learn how to do, how to redo. This is the movement that I need to learn how to get correct again, you see. And then as they become better and better, the help that the robotic part adds in becomes less and less and less. And that's, I think, the first important part one important part that I learned about why robotic physiotherapy is so helpful in early rehabilitation after stroke. So I thought that's a very important thing for my learning. That's how I realized, I didn't realize that how useful robotic physiotherapy is. Then only I realized this is how one of the things that is so helpful in early rehabilitation. It helps a person, they are able to do more and they're able to help more. I think some of the questions, I just go through some of the questions. I'm not sure, Roberta, are you able to look at the questions or not? But a few questions are, what is the first one? Does it apply to seniors seniors with osteoporosis issues or knee operation, like after knee replacement? Does it help?
Okay. So first of all, let me just answer about the osteoporosis. Definitely, we can use Keeogo for senior citizen, but if let's say they have osteoporosis, we would encourage them to have a bone scan so that we can know how severe it is, because some category of osteoporosis is not suitable for Keeogo use. But in the research shows that if patient with osteoporosis, they can gain some bone density with exercise. So, but we don't want to because Keeogo, that is weight, we don't want to overforce the patient. If let's say they are too fragile, so we may not able to use Keeogo for them. So for the safety issue, it's better for them to have a bone density test. Then we will define whether it is suitable for them, or we can use other ways. And for after knee replacement, yes, we can use Keeogo to strengthen back their pelvic muscle, their hip muscle, and also improve their range by some exercise. So after knee replacement, some patients may afraid of bending their knee. So this is one of the key point, or some of them may have a problem in strengthening their knee. So we can use Keeogo to exercise to like trim back their functional activity. Yeah.
Yeah, thank you. The next question by Dr. Liu on the patient, what was the frequency of session per week and what was the cost per session?
For the patient in the picture, is actually he having 3 times a week. 3 times a week. Per session is about an hour. But about the cost, I think you can contact to our Penang branch to find out more info about that, because I'm also not sure about the cost over there. So you can
Dr.
find
Liu,
out.
yeah, Dr. Liu, the Penang TAMC, Penang Keeogo, the only one Keeogo center is in Penang, is situated at the TAMC center, and that's located on Jalan Bagan Jemal. It's directly opposite the Porte School, on Jalan Bagan Jemal, directly opposite the Porte School. The Keeogo Center is located at the TAMC Center. The sessions are available on package, so it's cheaper than KL, I think, because they just started, so it's a cheaper package session. So we can contact you directly about the cost. And then next question. Does Keeogo offer treatment for L5 ventricular? Yeah.
Okay. So if let's say for this patient L4, L5 lithosis, we will have to see whether the patient problem is mainly on the gait problem, does the patient gait problem is affected, or the patient leg muscle is affected? If yes, then we can able to use Keeogo for that session. But if let's say it's just mainly the back problem, then we can do alternate way. So we may not need to use Keeogo. So it's a yes and no answer. We have to depends on the patient condition. Yeah. Am I answering the question?
Yeah, that sounds good to me. Let's say any other questions on come. Please feel free to put in your questions on this. So as I said, Keeogo robotic physiotherapy is available in Penang. There's only one center. It's located at the Taiwan Advanced MedTech Center, TAMC. That's located on Jalan Bagan Jamal, and that's directly opposite the Porte School. So you can contact us, or you can contact Tiffany, or you can contact any of the Keeogo contacts for further information or for an appointment and so on. Okay. So the options with regard to physiotherapy for stroke, I think it's very interesting. The idea being that we should try to, wherever possible, initiate rehabilitation for stroke as early as possible where we can. Yeah. Okay. So let's see. There are no other questions from the floor? All right. So if there are no other questions from the floor, can I just take about a few minutes just to inform the group about the TAMC Center and its role. The Taiwan Advanced MedTech Center really is a collaboration between the Chang Gung Memorial Hospital Foundation and a few entrepreneurs in Penang. And the idea is to try to build a bridge between Taiwan's healthcare services, and healthcare technologies, smart hospital solutions, and the healthcare systems in Penang, and especially in Malaysia. So at the moment, there are multiple advanced technologies that are on display, on demonstration already here. So, and everybody's welcome to drop by and have a look. For those of you who may be interested in knowing more about what is available in as a second opinion or as consultation with Chang Gung Memorial, you can actually contact Tiffany to get an appointment or to get out more information on how to move along this pathway to for a consultation, which can be either online or in person, or a second opinion or so on. Right? Keeogo Center is located here, so their treatments can be done and the sessions can be done here as well. So I'm just going to take a minute to run through the last questions. How effective is acupuncture for stroke recovery? I think the answer was provided by Dr. Wu. The answer is not very clear because I believe stroke has too many types and too many variability. So it's difficult to really try to classify which type of stroke on which type of traditional or complementary medicine acupuncture. So I don't think that answer is clearly answered. Yeah, but definitely it is not part of acute therapy of stroke. So if you have acute therapy, or if you have somebody has acute symptoms of stroke, means having symptoms of stroke now in front of you, acupuncture is not the answer, right? The earlier question about if the pressure drops below 100/50 and you feel giddiness or onset of blackout, then what you might want to do is take a rest for a while, sit down, lie down for a little bit, and then see how you are, and then and are you okay or not? If just occasional, then you might want to see whether it occurs frequently or is it just intermittently, right? Because intermittent, you may not be concerned. But if it occurs frequently, then it may be telling you that there's something, it might be an underlying issue with your blood pressure or your blood volume or some other things, right? And so maybe you want to seek some assessment with your doctors or so on. But if it's intermittent, it's probably not something, or once in a while, it's probably not something to worry too much about. Okay, right? If you're working, you're exercising a lot without any symptoms, that usually tells you that you're okay. All right, so if there's nothing much else for today, I would like to, on behalf of Tiffany as well as TMC and the speakers, thank all our participants for taking their time on this Saturday morning. And I will also, on behalf of our of TAMC, thank Dr. Wu, as well as thank Roberta and Keeogo for two very excellent lectures and two very useful information that's been shared to us. I'm going to hand you over to Tiffany. Thank you very much.
Okay, so thank you everyone for joining this health talk. If you have any more questions, you can always message me as well. So you have my phone number. I think I messaged each and every one of you before the one day before today lah. So yesterday. So anything you can message me. So I'll try my best to connect you with doctors or answer your question. Okay, so I will end the session now. Thank you. Have a great weekend.